test if there's a fracture on the tibia or the fibula. And you want to put the heel of both hands on the tibia and fibula and squeeze, and to go all the way down to see if there's any abnormalities in the leg to test positively for fracture. And you want to test both legs to make sure that it's not symmetrical.
I am doing the Thompson test. This test for an Achilles tendon rupture. You start with the patient lying face down on the table with their feet hanging over. You then grab the calf and squeeze and wait for a reaction in the foot. If there is no reaction, this tests positive for an Achilles tendon rupture. I will be doing the heel tap test. This examines for a fracture of the tibia, fibula, or the talus. You start with the patient sitting up with their feet hanging over the edge. You then hold the ankle and tap with gradual increasing force. If there is pain when hitting, then there is a fracture present in either one of the bones.
This is the eversion medial test. You want the patient sitting, and you want to grab the back of their ankle and their tibia and fibula. You want to evert the foot and look on the medial side for any gaps, and this will result in a positive test.
This is the inversion lateral stress test, which tests for an ankle sprain. You want to have the patient sitting on a table with their foot hanging off. Place one hand on their tibia and their fibula, and place the other hand on their calcaneus. And then you're going to pull the foot inwards, but you're going to look on the lateral side to see if there's any abnormalities, and look at the patient to see if there's any pain.
This is the Abbey's compression test, and you want your patient laying on their stomach and their knee bent at a 90-degree angle. You want to put pressure down on the foot and externally rotate to see the medial meniscus is torn, and internally rotate to see the lateral meniscus is torn, and it'll be a positive test if you feel pain.
This is the anterior drawer test for the ankle. Place one hand on the bottom of the patient's tibia and fibula. Place the other hand on the back of the heel. Push and pull on the ankle, and if there is pain, that is a positive test for an ankle sprain.
I'm doing the anterior drawer test, which tests for an ACL tear, and you want to have the patient to have their leg at a 90-degree angle, and you want to have your hands on the tibia and the fibula, and you want to usually pull out the leg to see if there's an ACL tear.
This is the McMurray test to determine meniscal stability. So first, the patient needs to be lying supine on their back, and second, you want to raise the leg and flex it 90 degrees. You place one hand on the ankle and one hand on the knee to promote joint stability, and you start abducting and abducting the knee while internally and externally rotating it. To determine if the McMurray test is positive, you will feel clicking, and if that occurs, then you know that the menisci is not stable.
This is the Lockman test, and it tests if there's an ACL tear, and you want the patient to have their leg at roughly a 45-degree angle with one hand on the femur and the other hand pulling the tibia back and forth. And if it's less stable, then you know that there's a tear in the ACL.
This is the valgus and varus stress test. This tests for the integrity of the ligaments of the knee. You have the patient lying on the table supine, and you grasp on the outside of the knee and apply lateral force for the valgus test. For the varus test, you apply lateral force, but you push on the inside of the knee. If there's no laxity, then there is instability in the ligaments.
This is the posterior drawer test. Have your patient sitting with their leg at a 45-degree angle. Place your hands on the fibula and tibia and push towards the patient away from your body. If there is an increased range of motion, that is a positive test for a PCL tear. This is the patella compression test. Place your hand on the top of the patient's patella. Ask the patient to contract their muscle and push down on the patella. If there is pain, this is a positive test for an injury in the patellofemoral joint.
Today I'm going to be doing the Clunk apprehension test for the shoulder, and you want the patient to be laying supine with their arm at a 90-degree angle with one hand on the humerus head of the shoulder and one under the elbow. And you want to abduct and externally put pressure on the arm and wait till you see some pain from the patient's space, and if it's positive with a grinding sensation, then you know that there's a tear.
This is a sulcus test to determine instability in the glenohumeral joint. The patient needs to be sitting down on a bench with their arms relaxed at their side. The examiner will place one hand on the shoulder, the affected shoulder, and the other hand on the elbow of the affected arm. You will perform the test by slowly pulling down on the affected arm, and you will feel for any inferior movement in the shoulder joint. If there is movement, that indicates that there could be instability in the glenohumeral joint. This is the inferior joint test for the shoulder, which determines humeral head inferior subluxation. First, the patient will be sitting on a bench, and they will abduct their arm 90 degrees and place it on the examiner's shoulder. Then the examiner will clasp both of their hands and push up and down on the humerus to determine if there's subluxation of the humeral head. This may also result in pain on the patient's face, so make sure you look out for that to determine if the test is positive. This is the acromioclavicular joint stability test, which assesses the integrity of the acromioclavicular ligament. First, the patient will be sitting on a table. The examiner will place one hand on the clavicle and one hand on the scapula and slowly push them together. This will determine if there's any instability in this joint. If there is, you will feel some cracking or popping, and the patient may experience pain on their face.
This is the apprehension test, and you're testing for a tear in the labrum, and you want it to be at roughly a 90-degree angle to the body, and have your hand near the wrist, and you want to rotate it externally to feel if there's any instability in the shoulder, and then you will know if there's a tear in the labrum.
This is the Apley scratch test, and this tests for range of motion in the shoulder. You start with the patient standing and have them reach one hand behind their head to reach for the opposite scapula. Then you have them take the other hand and reach for the top hand. If they are unable to do this, this means there is limited range of motion in the shoulder. This is the sternoclavicular joint integrity test. This assesses the sternoclavicular and costoclavicular joints. You start with the patient lying supine on the table, and you grasp the clavicle. You try to move it back and forth and side to side. If the clavicle moves, that means the ligaments are unstable.
This is the empty can test and the test for instability in the rotator cuff. Your patient standing with their arm at 90 degrees and internally rotated 30 degrees. You're going to apply pressure down and have it give back, and if they cannot do this, it tests for a positive test in an injury in the rotator cuff. This is the cross chest test and a test for AC joint arthritis. You want the patient standing with their arm at 90 degrees and their elbow at 90 degrees, and you want to push in a horizontal plane across the chest, and if pain, then it is a positive test. This is the posterior apprehension test. You want the patient laying on their back and their arm at a 90-degree angle and their elbow at a 90-degree angle. You're going to grab the back of the shoulder and the elbow, apply pressure, and externally rotate, and if there's pain or discomfort, it is a positive test for shoulder dislocation.
This is the anterior translation test. Have your patient lay on their back and place their arm and elbow at a 90-degree angle. Apply pressure towards the body and externally rotate the arm. If there is pain, this is a positive test for anterior instability. This is the interior rotation test for the shoulder. Have your patient place their arm and elbow at a 90-degree angle behind their back. Place one hand on the elbow and one hand on the wrist. When you let go of the wrist, if the arm does not move towards the back, that is a positive test for an injury in the infraspinatus joint.